Welcome to the DoubleACS Daily News. The state's COVID-19 vaccine bus will be making a stop at Attleboro's Willett Elementary School for the third time tomorrow afternoon. The walk-in clinic will offer the Pfizer and Johnson Johnson vaccines. We spoke with Attleboro health agents Jessica Horseman and public health nurse Jackie O'Brien to learn more.
So on Friday, August 27th, the city of Attleboro will be hosting the state vaccine bus at Willett School, which is located at 32 Watson. It'll be hosting the clinic from 12 to 6 o'clock. We will be having a variety of vaccines there that will include both Pfizer and the Johnson Johnson vaccine. It's open to the public and no registration is required. They'll be taking walk-ups on scene. If you're looking to get the Pfizer vaccine, it's ages 12 and up, and then the Moderna and the J&J are still 18 plus.
So it is a state program. And so what we have been able to do is, we send a request out to the COVID command team, and they are able to help us, look at dates. And, we try to select locations in the city to be able to, to have the clinics. It's a full-size bus. People can't miss it. It has the logo for VaxBus on it, and it's quite colorful. It's a lovely setup. It's air-conditioned inside. They will have people sign up outside under a pop-up tent, and that's where people are, stay for the waiting area afterwards. They have chairs set up for people, and it's really well run. The most number of people that we had access at were 43 people. The second time they came to Willett, people go sign up. They're checked, they're checked in. Then they go inside. They go through the screening process. They get their vaccination. They come back outside in the waiting area. We have not had any complaints. And we're always trying to encourage people. We have a lot of our pharmacies that are also offering vaccination. We have Manette Community Health, the Attleboro site that is offering it. We have our Sturdy practices, that people can, if they have a primary care physician through Sturdy, that they can reach out to their primary cares to see what they're doing in terms of vaccination also. So there are numerous options for people. People have to remember to, again, all the other protective measures that we have been encouraging all along, wearing masks, social distancing, staying home if you're sick. If you think you might have COVID, then get medical evaluation, doing good hand washing, things that we recommend for just about any disease anyway. The whole goal about vaccination for any disease is to, get to herd immunity. No vaccine is 100%. Again, what we are trying to do is we are trying to decrease the transmissibility of this virus. We are trying to avoid people having to go into the hospital if they do get diagnosed with COVID-19. Hopefully that they're having minimal symptoms, or hopefully that they're not going to catch it at all.
The importance of vaccination is really high right now. We want to protect people. We want to make sure everybody has immunity. We want to make sure transmission isn't going on. The vaccine is relatively safe. So I think the importance of it at this time is very high.
We don't know how many variants that we're going to see, but again, this is going to be ongoing. We're trying to stem the tide on spread of this disease. And this is just as in the United States, this is still a worldwide issue right now. It's a global issue. We need to keep working on it till we can keep this thing at bay and stem the tide. If people have questions, the best thing that they can do, and again, we understand people have hesitancy, is to educate themselves and get their information from reliable resources, whether it be a medical professional that they know or their own primary care physician calling this office, just to make sure that they are getting reputable information, as they're making their decisions for themselves. And sometimes it's some people for their families also, if they have children who may be able to, in the age group to get the vaccine, but aren't able to give permission for themselves. And if they have kids that are 12 to 17, to have conversations with them about it also.